I just woke up. Let's begin with the upper half of the urogenital triangle known as the vulva. This area has two holes. The most superior one is the urethra, which is where urine comes out after being held in the bladder. The anterior hole is the vagina. At the top of the urogenital triangle, there is a bump called the clitoris, which is also called Little Hill in Greek. The area between the anus and the entrance to a woman's reproductive system is called the vestibule. On either side of the same hole are Bartholin's glands, which secrete a lubricating substance. The outer part of the woman's reproductive system is full of an acid-based bacteria called lactobacilli, which is held in a smaller, more steep set of lips called the labia minora. The outer lips are called the labia majora, because they're bigger. On the lower portion of the abdomen, there is a fat pad we refer to as the mons pubis. Now we enter the inner workings of a woman. After venturing through the first tube, there is a cup-shaped opening called the fornix. Slightly further up, there is another opening called the cervix, which is covered in a slime-like substance called cervical mucus. Is the entrance where babies are grown called the uterus. This pouch has two main layers. The most superficial layer is a myometrium, which is a large muscle that contracts to cause cramps. The next layer is deeper, is called the endometrium, which has two layers within itself. The first layer of this section is the stratum bassalis, similar to the integumentary system. Next is the ragged layer and also the lining on the inside of the baby pouch that gets shed called the stratum functionalis. Inside of the layer that contracts for cramps, is where the circulatory system for the baby pouch starts and is in a coil-shaped line that supplies nutrients to the baby pouch. It is called the spiral arteries. The twin canals that lead to the baby pouch are called the fallopian tubes. On the opposite end of these twin canals, there are tentacle-like structures called fimbriae, as well as the hair-like structures inside the canals called cilia, which move the egg along. The tentacle-like structures pull the egg out of the ovary, which serves as stasis chambers for the eggs.
The scientific name for when a woman is on her period is menstruation. On day 1 of the cycle, the main female hormone estrogen is at a low level. On day 14, a woman is going through ovulation, which increases the chance for pregnancy, where the egg goes through fertilization and the egg wears a follicle around it, then later gets swooped up by the tentacle-like structure. If a woman is pregnant, she takes a pregnancy test, which tests for ACG. On day 22, the corpus luteum dies and the clothes that the egg, which also is called the embryo, was wearing, falls off. On the inside where the baby is held is a layer of tissue that lines the inside of the area, breaks off. The pieces travel through the tentacle-like structures and stick itself on the outside of the baby pouch. The pieces start to enlarge when the female hormone levels begin to rise, therefore compressing the outside of the baby pouch inward, causing the abnormal tissue damage called endometriosis to squeeze. An infection of the female reproductive system that occurs when the sexually transmitted bacteria spreads from the lady hole to the baby pouch that causes pelvic pain is called pelvic inflammatory disease. To help regulate a woman's cycle, a sex hormone is released. It also helps a woman's body through pregnancy by thickening the lining of the baby pouch to prepare for the egg. This hormone is called progesterone. 12 months after a woman's last period, she will experience changes in her monthly cycle, hot flashes, and other symptoms, which causes the natural decline in reproductive hormones when a woman reaches the age of 40 through 50s, called menopause.
Now that we have completed the female reproductive system, let's now go through the male reproductive system. The main part of the male reproductive system is the copulatory organ, which is used to make babies. The oval organs that are located below this organ that store swimmers are called testicles, and the bag of skin that helps hold them is called a scrotum. The rounded part that forms the head of the penis or a woman's little hill is called glands. To regulate the temperature of the oval organs, the dartos muscle is used to expand or constrict the sac. Vasodilation is when the blood vessels in the penis widen due to heat from sitting in a hot tub or exercising. Those little swimmers that are created millions at a time are called sperm, which is what attaches to the egg in order to get a woman pregnant. That is only a component of semen. There is an energy source that is found in the male reproductive system that is used for the swimmer's mobility called fructose. The seminal vesicles are glands that are located in the pelvis superior to the rectus that produce the fluids that will turn into swimmers. Spermatogenesis is the production of swimmers from the primordial germ cells. These primordial germ cells migrate to the developing organ that creates eggs and swimmers called gonads. With the help of the corpora cavernosa during sexual arousal, a penis can get hard, which means it has an erection. When the oval organs release the swimmers, it is called ejaculation. The secretion of the future baby liquid is released through a tube called the epididymis that connects both the oval organs to the head of the penis. Another tube that runs for the oval organs to the head is called the vas deferens. This tube is cut when a man decides to not have kids anymore. This surgical procedure is called a vasectomy. It can be undone when needed to. Prostaglandins are a group of lipids with hormone-like actions that your body makes primarily at sites of tissue damage or infection. The prostate gland is located just below the waist bag and in front of the poop hole. It is about the size of a walnut and surrounds the pee hole. It produces the fluid that nourishes and transports swimmers. The bulbourethral gland produces a cleanser that cleanses and lubricates the pee hole prior to the arrival of the swimmers. Mucus accepts, filters, and prepares and releases the swimmers for successful transport to the egg and future babies.